So yes, I think that the question is it going to be beneficial for your heart? It probably is not going to be beneficial for your heart, because actually it's moderate exercise that's beneficial to your heart long term in essence, okay? And even athletes, when we look at them, we know that, when they kind of, after 10, 15 years, there is some impact on the heart becoming dilated as a result of exercise. Does that have negative impact? Probably it doesn't, but it doesn't keep up with the parameters that we're aware of or what we tend to accept, so we end up monitoring them. But if the level of exercise you're doing, whatever it is, it's the same as where you were before, I think that's acceptable, as long as you're not experiencing negative symptoms as a result of it. So I'm the opposite. I don't say stop doing exercise. No. I say go back to where you were in your baseline, but start off slow, get there. Because you've had a time out. You can't just suddenly, I'm not very fit, but now running up the stairs I feel very breathless, but hopefully. But I used to do the marathons before, but partly because I haven't done it for ages. So it's exactly the same thing. It's sensible advice. Moderate exercise is fantastic, which is where all the data comes from, basically. But again, the data is biased because it's for cardiac patients who've had heart attacks. So there is a damage to the muscle of the heart. They're much older people. They've got risk factors. They're diabetic. They're hypertensive, where the SCAD patients are not. Okay. So I tend to look at, if you look at patients that are young, and hopefully part of what the SCAD research will do next, and something we'll touch on base later, is that we are trying to develop a cardiac rehab program. And the more of you that join in and take kind of the program with you, I'm going to roll you into it later. I haven't told you about it, but I'll tell you about it later. But essentially, it's to see what, where you are, what your capabilities are, and to get you there and kind of be able to answer those questions better. Because some of you are elite athletes and you're very good at it, and I can't see why you should stop. I hope that helps.
Yeah, there's more evidence around HIIT training as well, isn't there, coming out really? So we're keeping an eye on what's happening.
Just carrying on from that question, what is the potential risk? Because you're talking about the heart muscle, but I always feel with the exercise, it's more what are we doing physically when we exercise really hard, the pressure through the arteries, because obviously we're all worried about that artery tear again. And I think probably that this gentleman it's the same thing. So if I really, really push, I'm going to bust an artery.
Do you want to go ahead, or shall I?
We don't know. I mean, I wouldn't let that put you off. We want people to go back to their usual fitness and things. So, I haven't got the answer to say whether that's going to happen again.
No, I think that's the problem, isn't it?
Yeah.
So
I think that's the answer we
sure.
want.
I think if you're an athlete and someone who did quite a lot of exercise for years on, so you were running the same amount of running, before you had your SCAD, I don't. So you kind of then stop and think, well, hang on a second, why did it happen after this run rather than a run I did which was longer? And I don't think exercise is a contributor. I don't think the rise in your blood pressure when you exercise, if anything, blood pressure drops eventually with exercise. The fitter you are, your blood pressure will remain low, basically. So if anything, your vessels remain vasodilated throughout exercise. And this is why you need to warm up and cool down towards the exercise, is that your blood pressure doesn't suddenly jump or doesn't suddenly kind of increase at the end of exercise. However, what we know from seeing you guys and from seeing you in clinics is why I realise some of you are super fit, because you're made up to be super fit. You're genetically predisposed to it. So I don't think we've got any evidence as we stand that exercise is a cause for SCAD. I think patients who've got SCAD are younger, healthier, and they're probably genetically more kind of athletic built, so they can do more exercise. Not all of you, some are, but it's just the general trend of a population. If you look at a general population, you have some people who are not great. You get, people who are very fit, and then you get people who, who do moderate exercise. I think SCAD has that pattern. So I don't, as long as you know that, you're not pushing yourself and you're getting chest pain, you're feeling sick and you're about to vomit and stop breathing, then I think don't do all of those. But I think exercise, and those of you who are athletes, I don't believe the data, because there is no data. The truth is there is no data. And if we put you on a treadmill, and a lot of you have been on treadmills if you've been into cardiac rehab, majority of you, your blood pressure doesn't rise and your heart rate is actually quite good. So I don't think there is any data there, and that's what we hope to do with the cardiac rehab program, is actually put people on an exercise treadmill, get them to exercise to whatever capacity, and actually monitor them and see what happens, essentially. Some of that work has been done with the Mayo Clinic, and they've not been able to reproduce any data that suggests there is, a change in kind of the flow down the artery. If anything, when you exercise, and just to say this again, your arteries of the heart dilate, okay, because you release nitric oxide, okay, so there is nothing to suggest that you are going to have a heart attack as a result of exercising. If you've got a fixed stenosis, which is a narrowing and that's cardiovascular conditions, yes, there is an increase in shear stress because your vessel lumen wall is tiny because of a stenosis, so therefore an increase in blood pressure, increase in flow at that point, the artery cannot cope with it, and that's what could cause plaque rupture. But I don't think that's applicable to SCAD, and definitely there is no evidence that we can say, yes, withhold at the moment. I hope that answers some of that question. It's probably saying, I don't know, but...
I've started sort of horse riding again, and I've sort of got thoroughbred, and he's a little bit of a lunatic, and I've pretty much just stuck to dressage and avoiding sort of jumping and things, and the same with the mountain bike. I went out on the mountain bike, came off the mountain bike, and every time I sort of come off, whether it be the horse, I haven't fallen off the horse since my scan, but I worry about the blood thinners, and when I come off, it's normally at speed either on the mountain bike or on the horse, and I worry about the bleeding that I can't see. Do I need to sort of go to hospital? I mean, I don't, but my boyfriend's like really worrying, and normally I can see things like if I've hit myself and big hematoma, but should I go to hospital or not worry about it? Is it going to be a problem with the blood thinners, clopidogrel and aspirin?
Yeah. I think it's the same advice we give to any cardiac patients who are on platelet therapy. Obviously, try to avoid falling off anything if possible.
I don't want to come off.
Yeah, no, I get that. But obviously, if you see an injury, you need to keep an eye on it. So, if you're bruising on your arm and your arm gets bigger and bigger, don't sit on it. It's not going to get better. Your platelets are not working. That's the essence of those drugs. They stop your platelets from forming a clot. So where you fall and injure yourself, if you went on them, your platelets will clot whatever there is kind of to be clotted. In this case, they don't. So essentially, you will carry on bleeding into a cavity. I think basically my advice would be, if you hit your head, you need to get seen, because the problem with things like that, you present a lot later. So you might not get anything immediately, even then 12 hours later, you might feel unwell, and certainly you just need to keep an eye on it. But if you fall off and you bump your leg and it's bruised, I'd just watch it and see how it goes. You are unlikely to suffer internal injuries unless you literally... things like car crashes and kind of blunt injuries.
I'm worried about the sudden stop.
Yeah.
Are there things that might be that I can't see? I should go to hospital. Or
if they're blunt injuries, so what I mean is that it's not a sharp injury, it's a blunt injury. So there's trauma to the abdomen.
Or the horse saddle or something like that. Could you fall onto the horse saddle?
If I'm still in the saddle, it's really good.
Okay,
it's when I come off and hit the hard ground.
Okay.
I would carefully assess myself and wait for a couple of hours, and you would develop symptoms. In someone who's quite young, that you would have some symptoms. Obviously, if you feel unwell and you feel like you're about to faint, don't wait. Go to hospital at that point. But the advice is exactly the same for anyone who's on antiplatelet therapy. Is that if you have, if you hit your head or you see a bleed and it doesn't stop, take yourself to hospital. Blunt injuries are difficult because you don't see symptoms immediately, and you'll see it afterwards. So if you have something, if you hit, if you kind of fall on the abdomen and you've got pains, you need to go to hospital. If it's just an injury or a cut to the leg and then you're kind of watching it and it stops bleeding or it just bruises, obviously watch it and see what happens. I don't know if there's anything else you'd add to that.
No, not at all, really. We know that you're going to bruise really easily when you're on antiplatelets, so... She's observing it.
We've got time for one more question. Yeah. Is there any form of exercise that we shouldn't do, like lifting weights or squatting?
So there is some data. So again, the answer is no one really knows. Okay, there is some data from connective tissue diseases, like people who've got Marfan's. Okay, and we know that majority of you do not have Marfan's or any obvious connective tissue disorder. That kind of doing isometric exercises, which is squatting and holding your breath, can lead to increase in shear stress in the aorta. So this is not the coronary arteries, this is the aorta, and it leads to dissection. I have to admit there is nothing been proven for SCAD. Okay, and isometric exercise is something you do with cardiac rehab for strength.
Yeah, we wouldn't say no. We would just say small amounts and build up your repetitions gradually and listen to your symptoms. Really, it's just being sensible. It is that whole breathing and trying not to hold your breath.
And what I can say, if majority of you who come and see me, there is no one who said, "Oh, I had a heart attack while I was squatting." So it tells me. All it says is that it's not the risk factor for it. I think there are some people who are fantastic at doing yoga because they're very stretchy and bendy. I can't, kind of bend my thumb or my arms or do anything because I'm not that kind of person. But for those of you who've been doing yoga forever, don't stop doing yoga because now that you've had a condition, you're good at it because you're genetically built up to do it.
Can I just ask on top of yoga? I've been avoiding plank and headstand. So does that mean I don't have to avoid those anymore? I could do them before.
I think if you could do them before, go back to doing short planks and then build up your strength towards it. I can't see that has any detrimental effect, and your SCAD, I presume, didn't happen while you were doing a plank. So I don't think it has any detrimental effect. There is no data out there, but what we know from looking at everything that comes through the door, I always ask you, what were you doing at the time? Majority of you were like, actually I was sitting down, or I was watching TV, or I was walking to school. And if you think about how many times you've done that throughout your life, you've been doing it every single day of your life, basically. So, it doesn't say stop living or stop eating or stop driving. It's just to say this happened, in essence. So I think if you were at that level before, gradually build up. Yep. I don't think there's anything from a cardiac rehab point that would avoid it. I think if you've done it before, I could never do it. I'm very jealous that you can. I can't do a plank more than 10 seconds, but yeah. I think if you've done it before and you're good at it, do it. And obviously, be careful. You are on, for those of you who are on medications with the headstand, you may find it difficult. If you suddenly get a rush of, oh God, I'm going to faint, be careful because you are on medications. Your blood pressures will be lower than what they were before you even started off, okay? And these medications can change your blood pressure as well. So, if you're somebody who gets off of a chair and goes, oh, I feel a bit lightheaded, or now I'm okay, don't go and do head planks because what will happen, all the blood will rush away it'll go to your head first, and then because that's where gravity is most, and then you'll lie down and then it'll stay there because your blood vessels are completely different because of these blood pressure medications. So then you end up kind of being on the floor for a very long time and feeling very, very unwell, and then somebody will have to lift your legs up again to get you to get the blood pressure rushing. So if you're on medications, be sensible. Don't do things that will make you feel unwell, and you know this because you will feel some symptoms. So don't go kind of doing one of those things. Because then I'll be prosecuted for advocating that one should do a headstand.